Hey guys, welcome back to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are bringing you inside information from real conversations we have with patients on a daily basis. We get asked the same questions and want to spread the truth on health and healing because we believe everyone deserves to know the answers.
Welcome back, everyone. Thanks so much for tuning in to our third episode of What Did the Patient Say? Today, we're going to be talking a bit about cracking your neck and why it's very, very important that you do not crack your own neck and how this can relate to a lot of symptoms like headaches, dizziness, neck pain, migraines. The list goes on in which patients usually say that they get relief from cracking their own neck. But we want to debunk that and explain to you why that is not a good idea.
Yeah.
Take it away, Dr. D.
Yeah, I'm sure there's a lot of people out there listening that can relate to this. I always find it funny and interesting when patients come in and they do that on their own, and then they're very nervous about me giving them an adjustment. Like, we're the professionals. You're just winging it, you know? But I will say, like, I pick this up a lot of times, even on a complimentary consultation with patients where they're sitting on the video chat and we're talking to them about whatever, and they're like, and sometimes people do it and it's almost like they're hesitant to do it in front of somebody, I think, like on the video chat, because it's like subtle. I'm like, do you crack your neck? And almost always they're like, we're gonna need to stop doing that. And you know, kind of here's why, and kind of go into the explanation of that. And I've had a lot of patients where we've kind of caught it, even maybe before they come in to see us for an exam. And they're like, oh, I've had a reduction in my headache or my dizziness or, you know, my migraines or whatever, like just by explaining to them why that is not good for their system as a whole. So not only their neck, but their brain and everything else that comes along with it. So.
Yeah. So, just to kind of start from like a biomechanical standpoint, when somebody adjusts your neck, we've been trained to do that in a line of drive that lines up with different joints, facet joints, and things like that, to make sure that we're not causing early degeneration of the spine. If you're just like cracking randomly, you can actually affect those biomechanics and cause early wear and tear of the facet joints, which can increase your susceptibility for things like neck pain. So
yeah, and just for clarity, like there's a couple different joints, obviously in your body. Your facet joints are joints that are in your spinal column. A thing that I talk to people a lot about is, you know, when every joint has a certain amount of motion that is designated to it. And, you know, what if we're talking about the spine, right? All of your joints along from your neck, your back to your low back, right? It all has a certain amount of motion in all different planes, right? You can rotate, go up and down, you can laterally flex your head. Every joint in your neck is contributing to, in a certain capacity, your ability to do that. So what happens is that you crack your neck, right? And you do this and everything's like, or especially if like when people are doing these kinds of things, I'm like, it gives me the like goosebumps. But what I explain to them from not only a joint perspective, but also a brain perspective is when you do that, you're actually putting more motion into a joint that shouldn't have that much motion. So you're actually creating instability in your spine by continually cracking your neck like that. What happens then, the response in your body in the system at large is your brain especially doesn't want your neck to be hypermobile. So what your brain's going to do is recognize that increase in motion, and it's going to send signal down to those joints, those muscles, those ligaments, and everything that's associated with that, what we call a joint complex, and say like, ooh, tighten everything up around that joint complex, because we don't want you walking around like a bobblehead. We're afraid that you're going to injure yourself, right? And then to you, what you experience is like, oh, now it's tight again. And usually it's a quick process. It's like you crack your neck, release some endorphins, your brain's like, ooh, that feels great. And then 2 seconds later, it's like, that's not good. So then it's like, tighten everything up. And you're like, oh, my neck is stiff again. And then 20 minutes later, you're like, and the cycle starts all over.
Yeah, I talk about that a lot with my dizziness patients who often either have already been to a chiropractor or they ask about whether I'm going to adjust them. And my topic of conversation is always your neck is probably tight because you're having dizziness. And what your brain's doing is trying to increase feedback from your neck muscles. So yes, you do need your neck adjusted, but you just may not need it yet. And we definitely don't want you cracking your own neck because you're getting rid of that stability that was created to try to make you feel less dizzy. So it becomes this vicious cycle. I had a patient who she was not very excited when I told her not to crack her neck anymore.
I don't feel like anybody's super jazzed when we tell them.
And I didn't even want her doing any like stretches of her neck because she was having so much dizziness. I said, I need you to kind of power through what you're feeling in your neck, because when we can get you less dizzy, what I would expect to happen is that tension in your neck should start to fade away. And then you should respond much better to adjustments, and you should hopefully not feel the need to crack your own neck.
Yes, I usually tell people, like, if they're diligent about it, because the other thing that happens is it becomes a habit. So a lot of people do it and they are not even realizing it, and they catch themselves like after they've done the deed. And so I tell them, like, you really need to consciously be aware over the next, and I tell them 2 weeks. Like, I've really found that, like, if the people that we talk to about this are doing what we're asking them to do, usually in about 2 weeks, I feel like things are a little bit more stable and you feel less like you have to actually do that. And I always tell them in the meantime, because, you know, once you're used to doing that, you're going to feel a little sore and uncomfortable, like at least initially in your neck, because that's the whole reason why you're doing it in the first place, right? You're like trying to relieve some tension. So I always tell them alternate ice and heat, no more than 15 minutes at a time, to help just relieve some of the discomfort that might come along in those first 2 weeks. And it seems to work pretty well for a lot of people. And then, you know, we kind of have the conversation of like, you want to be able to adjust you if it's appropriate for your system, your, you know, biomechanics, your brain and all of that. But then we're going to go in and do it at a point that's appropriate for you, for your brain, but also to make sure that we're creating enough stability and mobility for the system as a whole.
Yeah, I would agree. I think that's really the best avenue, especially for people with headaches who feel like that relieves their headache. Is you could be perpetuating your headache. So we kind of need to get you past that hump. And then for a lot of patients, it's once we can really isolate, you know, aspects of dysfunction that are perpetuating the problem of the headache, then it becomes much easier to not feel the need to crack your neck.
Yeah, so like trying to hold back on that short-term satisfaction of doing that, and like understanding that long-term it's actually not helpful, and that not doing it is going to be much more helpful. And then finding somebody that is trained in actually doing it and making sure that the system is functioning all together is really going to be your best avenue at that point. Like, I used to crack my neck, I don't anymore. You know, I've had maybe some reduction in my symptoms, but I'm still dealing with some of these residual things. You know, reach out to somebody that has some experience. Reach out to us and we'll be happy to help.
Yeah. Yeah. Find your local chiropractor that you trust, and definitely utilize them for what they're very good at and what they're trained to do, is to help you be able to do that in an appropriate fashion. Yeah,
absolutely. Well, if you guys have any questions, you know, like we keep saying, shoot us a comment, send us a message. As always, you know, if you like this information and it's helpful to you, or you have somebody that you think will be helpful for, please share it. Follow us on Instagram, head over to our YouTube channel, and hit subscribe. And the more content and information that we get from you guys, the more we're going to be able to give back and get you guys some information that you
yeah. Thanks
Have
for
a good
tuning
week.
in. See you
See you
soon.
soon.
Bye.
Bye.